Okay, can you hear me now? Can you see me? Miss McCaskill, can you hear me and can you see me? Okay, can you hear me now? Can you see me? Miss McCaskill, can you hear me and can you see me? Okay, can you hear me now? Can you see me? Miss McCaskill, can you hear me and can you see me? Okay, can you hear me now? Can you see me? Miss McCaskill, can you hear me and can you see me? Okay, can you hear me now? Can you see me? Miss McCaskill, can you hear me and can you see me? Okay, can you hear me? Okay, there we go. Perfect, perfect. Okay. My apologies to my Facebook page, those who are looking. Okay. I was just going to, as I was saying, I was just going to do this on Facebook, on YouTube on tonight, but I saw something that popped up on my my Facebook feed, and it confirmed my tonight's discussion. I was going to download the video so y'all could actually see what took place, but use your imagination as I describe the video as we get to that part of the discussion tonight. Tonight, we know this is part two of the Caregiver series. This is part two. And tonight we're going to talk about the nursing home, the hospital, and the agency. And then next week we're going to talk about the caregiver. Um, well, we'll see where we go next week. But this week we're going to talk about the nursing home, the caregiver, and the nursing home, the agency, and the hospital. The caregiver, the hospital, and the nursing home. Okay, and then next week we'll talk about the caregiver, the agency, and the aid. But this week we're going to deal with the hospital um, uh, and the nursing home. Now, as a caregiver, where's our responsibility stop? It doesn't stop. We are once a caregiver, we are always caregivers to our loved ones. Um, And as I said, I think I said this on last week. If I didn't say it on last week, I'll say it now. Caregivers, you as a caregiver must be on top of your care for the individual you're caring for. Okay. Go to the live chat. Okay. On top of the caregiver that you're caring for, you must know what's going on at any given point in time. You must be there. Let's talk a little bit tonight about the hospital. Um, there's some things I cannot say because I work for a hospital, but I am going to say some things that I can say as a caregiver and as a husband. Now, let me just make this disclaimer as before I go there tonight. The things that I discuss on these lives is things that I encountered and I've been through as a caregiver. I'm going to say it one more time. Here's the disclaimer. The things that I am going to discuss tonight and going forward and have already discussed is from the point, the seat, the vision of the caregiver and the husband. I've been a caregiver to my wife for 13 years. I've seen a lot of, I've seen just about almost, if not everything, I've seen a lot. So tonight I want to talk about, before I go to the nursing home, because I'm going to spend a little bit more time on the nursing home, but I want to talk about the hospital. One thing you need to know as a caregiver, one thing you need to do as a caregiver is the first thing, if the person cannot make a decision for themselves, you need to get either one, power of attorney, or what's the other one? Power of attorney or guardianship. Okay, you need to get power of attorney, which is very easy to get, or guardianship. You need to always have access to an attorney. Make sure you find an attorney. If you don't have one, you don't know one, Find one that you can put some that you look trust that you can trust and that'll be in your best interest. And lock in on that attorney just like you would on your PCP or your doctor. Like I said on last week, establish a relationship with your attorney, whether they be male or female, because you're going to need their services as time moves forward. Now, we're going to talk about the hospital for a little bit tonight, and then we're going into the nursing home. As I said, there's two things you're going to need, or one thing you're going to need, either power of attorney or guardianship. What is power of attorney? Power of attorney gives you the right and the authority to make any and all decisions for the individual. If the individual is able to speak and to know what's going on around them, and they're able to give you verbally the power of attorney when you enter that hospital, you need to make sure that it's on the chart. I'm going to say it again. You need to make sure that the patient puts it on the chart, that you are the one that will make all decisions concerning their health. Then you need to have legal power of attorney if it gets to that point, and that individual just cannot make decisions for themselves. You need to have legal power of attorney or legal guardianship. Those two things will help you, and it will help your position as a caregiver a whole lot easier. Why do I say that? I say that because in the medical realm, in the medical field, if you don't have power of attorney, you don't have guardianship, or the patient or the person that you're caring for has not given the hospital permission to speak to you, you will not be able to find out anything. You won't get no questions answered. You won't get nothing answered. You won't have no input of what they do to that patient, what they're giving that patient. You can ask all day long, what kind of medication is that? They won't answer you. But if you have power of attorney or you have guardianship and it's on, and make sure that if you have those papers, that you give them a copy. Let me drop this real quick. Never give your originals. Give them copies of your power of attorney or your guardianship. Give them copies and make sure, stand there, watch them, make sure that it's placed in the record, in the chart. They call it the chart. Make sure it's placed in their chart or in their records. This way, you have all the rights. You have the say so. You have the ability to make any calls that you need to make concerning the individual's health. Because I'm going to say this. A lot of times these hospitals, and I say use the term hospital, I'm talking about general all over the globe. A lot of times these hospitals will do things to your loved ones and won't tell you a word. They will railroad, and that's exactly what it is. I was going to say talk them into, but they will railroad them into procedures or medications that is not needed. Had I did not have power of attorney, and had I not been my wife's husband, if I was just her brother, I would have had a problem. But because I was her husband, I had some legal grip. But had I not had that, along with the power of attorney, she might be in a nursing home today. Because what happened? Let me drop this to somebody that might not know. The case they appoint a caseworker when you enter the hospital, whether you healthy, halfway healthy, or any type of situation that you have to be hospitalized for, they, I think I've frozen, they appoint a caseworker or a case manager. They used to call them caseworkers. Now they call them case managers. Those case managers are responsible to see to it that your plan of care goes forward smoothly. Now, let me say this. They do some crazy stuff behind the scenes. I can't say what I want to say, but read through the lines. Let me put it like that. Read through the lines, because if I was retired, then I would be able to really put it out there. But they do some crazy stuff and make some crazy decisions behind the scenes. They do their huddles. Please read between the lines. They do the huddles behind the scenes, and decisions are being made. Discussions are being had. Decisions are being made. And a lot of times it does not include the family, not even the person that's appointed to take care of that loved one. And what I have seen during the short time my wife was in the hospital, I had to deal, I was there as a husband and not a counselor, or not even, I'm not really a counselor. I was not even in the capacity of a preacher. I guess once a preacher, always a preacher, no matter where you are. When my wife was in the hospital, there was a gentleman there, and he approached me and he asked me, was I a pastor? I said, yes. I said, no, I'm not a pastor, but I'm a minister. I'm an ordained minister. He was of the Muslim persuasion. And he began to talk to me, and he began to say to me that he started to weep a little bit, and he said, they're trying to take my rights from me. My wife is in a coma, and I don't know, they're trying to take my rights, and they're trying to make me, they're trying to put her in a place where they take care of those people who are in vegetation, in the vegetative state, that they expect never to come out. He said, and they're trying to do this to me. I don't know what to do. I told them I don't want that. They said they have to do this. It's not a decision that I don't have a say so. I said to the gentleman, I said, sir, you're her husband. What you need to do is get on the phone and call your attorney, and have your attorney draw you up a power of attorney real quick. And when you walk back in this hospital, or either have him deliver it himself, this way he's here with you. I said, and get that, and you and that attorney, get a hold to that caseworker and deliver that power of attorney. This is what happens. Some of the things that happen in a hospital. God bless you, Deaconess Sparrow. Deaconess Sparrow. This is what happens in a hospital setting. They will try to railroad you or try to take your rights from you as a family member who has the say so. They will do whatever they need to do if they think they can get away with it, and you don't have the knowledge. Now I'm getting ready. I hope y'all got some pen and paper, because I'm getting ready to give you some information. You need to write this down, because not too many people know this. And this also pertains to the nursing home as well. There is how can I say this? An agency. Let me use that word term. There is an agency. It's called the Ombudsman. The Ombudsman. The Ombudsman is an advocate for the patient and the family. If you see something out of place, if you feel that they have done something out of place, if you feel that the decision was made without your consent, you have the right. I don't have the number in front of me. So if you want the number, inbox me on my Facebook page or you know what? I'm going to put my email address up here. Just give me one moment. Um, okay. Just ignore the Cash App. Um, that's not my interest right now. Um, email if you want to. If you want that number of the alms bondsman, just email me at Wings of an Eagle Worship Hour, and I will get the information to you. Or if you're on my Facebook page, you can inbox me, and I will get that number to the alms bondsman. Every state has an alms budgeman. Every state, and you have the right and the authority to contact that alms budgeman. They're there to protect the patient. They're there to protect, God bless you, Tony Clark. They're there to protect the patient, and they're there to protect the family. Now, with that being said, you as the caregiver, whether you're the daughter, whether you're the son, whether you're the nephew, whether you're the niece, the cousin, you as the caregiver are just a dear-hearted friend. Because I know some people have very close friendship and ties with friends, and sometimes they allow the friends to be their caregiver and their spokesperson. You as a caregiver, I must encourage you tonight, and I'm gonna drop the disclaimer one more time. These are my opinions. This is what I know of my experience as a caregiver for 13 years. You as a caregiver, if you have a loved one in the hospital, again, you must establish some type of relationship with a nurse that is attending to your loved one. You must establish some relationship. If your loved one's in the hospital, know who the nurse manager is. Get her number or his number where they can be reached. Also, they used to call it patient consumer. Now, I don't know what they call it now. They used to call it patient consumer's affair. Mr. McCaskill or Tony Clark helped me out here. I don't know what they're calling it now. But it used to be called patient consumer or patient consumers affairs. I believe it was called at one point. Those are the people that you can go to on behalf of the patient and lodge a complaint. If the nurse does something, says something that she shouldn't be saying, she shouldn't be doing, if they're treating you badly, if they are, God bless you, Sandra Palmer, if they're treating you badly, if they are disrespectful, um, for example, when my uncle was in the hospital, I won't call the name, but when my uncle was in the hospital, my aunt had called me at that time. Both of them are gone now. My aunt had called me at that time. I was at work. They called me, and I went to the ER. He was in ER from Friday night to Tuesday morning. Well, you know, me being who I am, my family, I'm not having that. I went to Patients Affairs or Consumers Affairs, and I just did what I had to do and just let them know by 12 noon, I expect him in a room. Otherwise, I'm going to take the next step. By 12 noon, he was in the room, comfortable. So what I'm saying to you tonight, you that are viewing tonight, and I'm going to do a part 3. You that are viewing tonight, what I'm saying to you is simply this. There are things in place that will help you take care of your loved ones in the hospital. Don't ever think you don't have any rights. You have the right as a caregiver and the patient to ask for a copy of the patient's Bill of Rights. Know them, read them, know them. Know the patient's Bill of Rights. The patient has rights. Know the rights. Know the rights. Familiarize yourself with the patient Bill of Rights. So when they start doing some off the wall stuff, you know what they can and cannot do and what the patient has a right of. And one of the things I can say off the top of my head that I can remember right now, and I may mention some other as they come to me, the patient has the right to the utmost care. They have the right to care. They cannot be thrown out of a hospital, out of an ER, or anywhere without treatment. They've got to treat the patient, stabilize the patient. They cannot put them out of the hospital. For example, if I walked into the hospital and I told them I wasn't feeling good, they cannot tell me, oh, you got to go somewhere else. They have to take me, they have to examine me, and they have to stabilize me if necessary. That is my right as a patient. That is my right. Also, to you as a caregiver, familiarize yourself, it was just on my mind, with the HIPAA laws. The HIPAA laws are there to protect the patient. Familiarize yourself. Google it. Go on Google if you need to. Pull up the HIPAA laws of the state of New Jersey or whatever state you live in that you're viewing this at. Pull up the HIPAA law and familiarize yourself with the HIPAA laws. Knowledge is power. And that's the problem with black folk now. Yeah, I said it. Knowledge is power. Familiarize yourself with your HIPAA laws. Ask about the ombudsman and get the phone number so that you'll have that. Put it in your cell phone. Everybody walks around with a cell phone. Put it in your cell phone. Get the number to your caseworker. Put it in your cell phone. Get the number to your your nurse manager. Put it in your cell phone. Familiarize yourself with the nurse that is taking care of your loved ones and establish some type of professional relationship with your nurse. This is all going to help you take care of that loved one. Because I'm telling you tonight, I have heard horror stories of loved ones dying premature deaths at the hands of medical professionals. I've heard these horror stories. And it becomes a cover up. It becomes a cover up. Either wrong medication, sometimes something, it becomes a cover up. And nobody knows nothing. And then they want to say, oh, it's just natural causes. No. Or they want to label it as a heart attack. No. So know, one, what they're giving your loved ones. You have that right as a caregiver, especially if the individual cannot speak for themselves and you have power of attorney. You have that right. If you're the husband, you have more rights in the world. If you're the son, keep in mind, normally they look at the oldest one, the senior child. But if you are the son and you have been left in charge to take over your parents' medical care, you have the right to find out, what are you putting in my mother's intravenous? What is it? What's the side effects? Why are you giving it to her? You got to ask these questions. If you have a family of 5, 10, 5, 7, 8, y'all going to have to come together Drop all the nonsense, come together, get close together. Will y'all be able to talk? And y'all's eyes is everywhere. The reason why, and many of y'all have seen my wife that are on tonight, many of y'all have seen my wife. The reason why my wife is in the condition that she's in now, and she looks so well and so good, is because I was on top. I literally lived in St. Joe's Hospital for 3 months. Literally. The waiting room was my bedroom, my crying room, my prayer room. I went as far from the waiting room to her room. That's as far as I was. Only time I left the floor, only time I left her side is when either my daughter or my sister-in-law came and I said, give me a few minutes. I need to run downstairs and get me something to eat. I never left her alone because I didn't trust them. She wasn't able to tell me what they're doing, and I would have never known what they're doing. That's a nursing home. That was in Kessler. I haven't got there yet. So what I'm saying tonight, and I know I'm spending quite a bit of time on the hospital. I got to get to the nursing home real quick. Know again, you have access. Know your caseworker. Know the nurse in charge. Your nurse manager. Know your ombudsman. Get the phone number. Ask your caseworker. I need the phone number to the ombudsman. And be on top of everything. Make sure if your loved ones, I'm recapping because I'm getting ready to move and talk about nursing home care. Make sure your loved ones give you power of attorney if they cannot speak, if they cannot talk. Get you an attorney, get power of attorney, or get guardianship so you can make the decision without any problems. Without any problem. Now I'm going to talk about nursing homes for a little bit, and then we're going to finish up for tonight, and then join me next Thursday for part 3, when we talk about the caregiver, the agency, and the aid. Let's talk a little bit about nursing home. Nursing home is no place for a human being. Nursing home is what I call the graveyard for your loved one. Nursing home is a place where I believe, this is just me now. I feel and I believe is where people put their loved ones because they just don't want to be bothered. But let me ask a question to all of those who are viewing and those who may see the replay. If our parents sacrificed for us and took care of us, took us to the doctor, labeled us in the hospital, we need to be hospitalized. They took care of us. They worked hard all their life. They took care of us. They gave us. They made sure we had. Why isn't it we cannot take care of them? Why is it that we cannot take care of them? And a lot of times there's more than just one in the family. There's more than just one son. There's more than just one daughter. Why is it we cannot come together? Especially we as black families cannot come together and take care of our loved one. White folks will set up a schedule around the clock. They'll bring their parents home and they'll set up a schedule around the clock where one family member comes in for a few hours, another family comes in for another few hours. They'll set up a schedule. They'll even set up a time when the person will go on vacation and another family member will take over till that person comes back, and the other two will switch off. But it's something about black families. We as a black people, We want to take our loved ones and throw them in a nursing home. And then we don't want to go there. We don't want to go there and visit them. We don't want to go there and see what's going on. I want to say this tonight. God bless you, Pastor Graffy. I want to say this tonight. Make sure that you go to that nursing home. You stay on top of things. I saw a video tonight, and I shared that video on my feed. So those who have Facebook, go back and watch it. It'll break your heart. It's a nursing home out in Alabama. The video clear. The worker, the medical worker, is beating on this poor Caucasian woman, a black aide. I'm quite sure she's got to be an aide. And then they call them nurses' assistants. Was beating on this Caucasian woman. I watched it. My heart went out. Bounced her head off the wall and then took her by the hair and pulled her out of the wheelchair onto the floor and dragged her by her legs. And that's when the video, at that point is when where the video stopped. Don't think these things don't happen. That's not the first video I have seen. That's not the first video I have seen. I got you, Pastor Graffy. Give me a few minutes. That's not the first video I have seen where nursing homes have people that work for the nursing homes have been violent towards the patient that is helpless and can't help themselves, can't fight back. Couldn't have been me because baby, you'd be in jail. I'd be in jail. I'd be in jail. I'm going to share this with you. Pastor Graffy, I'm going to bring you on and give me a few more minutes. My wife was in a rehab center. I won't call the name of the center because I am live. She was in a rehab center after I transferred her from St. Joe's to the rehab center. After all the weeks and days that I had lost rest, I was extremely tired. I went up with her the first day, got her settled into her room, spent that night there, put all my notes up on the wall, my phone number, all my notes for the nurses to see, made sure they were familiarized with everything. Make sure they're familiarized with everything. God bless you, Sister Susie. Make sure they were familiarized with everything. I think it was a Tuesday night. I drove back to Patterson, went to my sister-in-law's, just about to get into bed, and my cell phone rings. It was the nurse. I heard my wife in the background. I heard my wife in the background screaming and crying. I got back in my van, drove back to that facility. When I got there, it was late at night. It was about 10:30, quarter to 11. Security wouldn't let me in. I told y'all got two options. Either you let me in or I break in. Y'all got two, but I got to get to my wife. They called upstairs because they were expecting me. They called upstairs. They let me in. I went upstairs. When I stepped off the elevator, I heard my wife screaming and crying. Got to her room, and I said, "Baby, what's the matter?" She wasn't talking like she's talking now, as good as now. But all she could say was, the man, the man, the man, push me. The man, push me. The man told me to shut the H up. I woke the whole floor up. Yes, I did. I woke the whole floor up to the point security was on the floor, and I dared security to touch me. I demanded that the nurse manager get there and get there now. Oh, she's not. She's. I said, page her. See, when you got to know these things, they can be paged. They have a pager. Now they have a separate phone. They don't use pages anymore. So now they give them a separate cell phone. Most of them walk around with apples. They got her. She came back to the facility at night, and I flipped again. And I made it perfectly known. No man is allowed in her room but me. And if the doctor comes in, the nurse must be with him. The next morning, I stayed there that night, and the next morning, I went. So I was opening my door. I went to the CEO of the place, and the secretary told me, "Oh, you can't enter her office." I said, "Watch me." I was polite. I knocked on the door, and I walked in. She must have known I was coming. This is what I'm saying. You've got to be on top of things, because things happen in nursing homes and in hospitals, and they're not going to tell you. More so in nursing homes. More so in nursing homes. Know who your ombudsman is. Know your rights, your Bill of Rights as a patient, both in nursing homes and hospitals. Know your nurse manager. And for goodness sake, if you must have power of attorney, please get it, or get guardianship over your loved ones if they're not able to speak and make decisions for themselves. Because these things go on in nursing homes. People are not being fed. Medications are not being given. They're not being bathed. They're left sitting or laying in their own urine or feces. I'm telling you what I know. I walked into the place, that facility, on 2 different occasions. One occasion, the wife wasn't fed. Her food wailed by the window and still sitting on the table. She had not eaten. Walked in, she's crying, she's hungry. Another time I walked in, the bed was soaking wet, and so was she. These are the kind of things I want to warn people about. I'm going to bring you on just a moment, Pastor Graffy. I want to warn people about. I want to warn people about. This is a night of this discussion. This is not just for me to talk. Those who want to come on Facebook are welcome to, but next week I won't be on Facebook. So if you're going to come on, you got to come on to Facebook tonight. So these are the kind of things I want to warn people about. Things are happening in nursing homes and in hospitals that the family will never know about if you're not on top of it. Hey there, Pastor Graffy.
Praise the Lord, Apostle.
You wanted to join in on the conversation?
I sure do.
Come on.
You don't mind.
Come on, talk to us.
I was in this home years ago. And if you do not, and I repeat, if you do not go and visit your loved one, they will not be taken care of correctly. They get the worst care because they know the family does not care for them. But if you want to always go and check on them, they give them the best care. If you have to put them in there, fine. Make sure you go every day at different times. So that way you'll see what's going on. They'll steal from them patients. They take their clothes. They don't give them the right bath. They be wet for a long time. They don't give them no showers sometimes. That's because they feel if the parent or the family doesn't care, they don't care. So please, if you're able, take care of your loved ones at home. If not, visit. And like I said, pop up. Don't let them know when you come.
That's right.
Do not. Nursing home is all about the dollar.
That's right.
So you have to be aware of that.
Absolutely. Absolutely. You have to be aware. And that's one thing, those who are watching this, one thing, beloveds, I did. I never entered the nursing home at the same time. They had no clue when I was coming. I did the same thing at the hospital. Well, I was there all the time at the hospital, but when my wife was in the rehab, they had no clue when I was coming in. And that's how I was able to catch her bed wet. I was able to catch her not being fed. I was able to catch them because they didn't know when I was coming. I was able to catch that she had not been bathed. Her clothes had not been changed. Her bedding had not been changed. I was able to catch her because I came in at different times.
That's right.
So that is important. If you just must. But again, that's just nursing homes. I feel is a place just to throw your loved ones away because you don't want to be bothered. Somebody said, "Well, I got a life to live." They had a life to live when they birthed you and they raised you and they took care of you and they did for you and they sacrificed for you. They had a life too, but they put their life on hold till you turn 18 years old. And then sometimes, and I'm a father, so I can say this. Sometimes after 18 years old, you still taking care of them.
Amen.
So I'm encouraging you all who are watching. You heard Pastor Graffy. She's one of the pastors for the Victoria International Fellowship. You heard her. Now she said some things I was headed to. I ain't got a head there now. She said it. So I'm telling you, you nursing homes is horrible places. Hospitals are not that much better either. You got to be there. You got to be on top. And now I say this to black families especially. And I know most black families is more than one child. The minimum is two. Sometimes it's only one. That's the daughter or the son. Then you need to get the cousin involved. You need to get one. You need to get your close cousins involved. Somebody else to help you care for your loved one and to rotate taking care of your loved ones. But if you got more than one sibling, there is no reason why you can't bring your mama or your daddy home and take care of them. And I'm going to share that with you in maybe the third part of it when I talk about Medicare and Medicaid. Provisions are out there. Provisions are out there where you can bring your loved ones home and take care of them at home unless they really need that nursing attention. But I'm going to deal with all that when I deal with Medicare and Medicaid and talk about that later. That's why I brought my wife home. They wanted me to put her in a nursing home. They kept pushing me, put her in a nursing home, put her in a no, I'm not. I will leave my job. I will quit my job and I will stay home and take care of my wife. But I thank God I didn't have to quit my job. But I do take care of my wife. And those who have seen her, either on live or on person, can tell I take care of my wife. My wife has never had, I'm going to share that with you too as I talk about nursing home and the hospital. It goes for both of them. My wife has never had a bed ulcer, better known as a bed sore. Her sugar has never been out of control because I stayed on top of it. I walked into the hospital one day. They have the schedule posted on the wall when they're supposed to turn her either to the door or to the window so she does not get on her back, so she does not get bed sores. Walked in one day, they had not turned her. Of course, she was wet as well. Guess who went off the hook? Me. So I encourage you, when you have to, as taking care of a loved one, get the knowledge of how to take care of them before you bring them home. If you plan to bring them home and you want to bring them home, sit down with a nurse, sit down with the psychiatrist, sit down with your doctor, and get the knowledge of how to take care of your loved ones. I did. I had to. I had to learn how to turn her in the bed. I had to learn how to change her and to clean her up in the bed. I had to learn. I'd heard the aide talk about a pull sheet. I had no clue what a pull sheet was. I know now because they showed me what that pull sheet was and what it's supposed to do if it's on the bed properly. It'll save your back because some people are so bedridden that they can't turn themselves. So you got to turn them. And this is why a lot of people have bed ulcers, better known as bed sores. If they're bedridden and they cannot sit up in the wheelchair and they're totally bedridden, know how to take care of them. Put those feet up on the pillow so their heels don't get bed sores. Turn them every 2 to 3 hours to the right or to the left. Putting a pillow on the side of them so they can't turn back or their body just don't go back on its own. You're propping them up, propping them on their sides. These are the things that must be done to take care of your loved ones. Is it tedious? Yes, it is. Yes, it is. Is it strenuous? Yes, it is. But I'm here to share with you tonight as I get ready to come up off this thing. I've been on here long enough now. I'm here to share with you tonight. Take care of your loved one. You have access to your ombudsman. Get access. Get the phone number. Know your case manager. Know your nurse manager. And of course, I always said, and you'll hear me say it throughout these lives, have established a relationship with your doctor or your PCP or your cardiologist or your endocrinologist, which is your diabetes doctor, if that's what they have. Establish a relationship. If they're in the hospital, if they're hospitalized and they're not able to make decisions, get that power of attorney or that guardianship so you can make any decisions need to be made. So, because I promise you, they will not talk to you. They won't tell you. You can ask all day long. I don't give you. I'm her daughter. They're not going to give you no information. That is a HIPAA law. You have to be on the chart, or you got to have some type of legal paperwork that you are the one that makes all decisions for them, and that you are the one that is now in charge of their care. Get you a lawyer. Make sure you have a lawyer, as they say, in your hip pocket. Be sure you have an attorney in your hip pocket because you're going to need that attorney as time goes forward. Thank you so much tonight. God bless you, each and everyone who have joined me. I'm gonna stop right here. Thanks so much for coming. Thanks so much for joining me, Pastor Graffy. Thank you so much for coming on tonight, sharing that with us tonight. We greatly appreciate it. Amen. We greatly appreciate it. We greatly appreciate it that you came on tonight. Thank you so very much for coming on tonight and being with us on tonight. Pastor Minister McCaskill, thank you so much. Sister Susie, thank you so much. Amen. All those who shared on tonight, thank you so much for coming on and being a part of this live. I gotta go. I'm gonna go now. It is just about 9 o'clock. I've been on too long. But next week, we're going to talk about we're going to talk about the caregiver, the agency, the aid. And boy, am I gonna share some stuff next week. See you next week. Bye bye for now.